Thank all of you out there.
This is an ABC6 News special report. Governor Mike DeWine is about to reveal new details in the fight against COVID-19. Let's listen in.
I want to really open today by showing some social media videos. Our team has been working and has a number of Ohioans who you will recognize who have done some of these. And then we're also going to move to the future videos, the men and women who are out there who are just making a difference every single day. We've reached out to well-known Ohioans, asking them to record messages, letting people who follow them know that we're all in this together, and to stay home to help us flatten the curve of the pandemic. These are tagged with hashtag #InThisTogetherOhio. In This Together Ohio, and hashtag Stay Home Ohio. Let me say we're appreciative of all those who have done this. Chris Spielman, Matt Brown, UFC fighter Jenny's Ice Cream, you'll recognize her. Of course, Jim Tressel, Gene Smith, OSU Athletic Director, Cam Atkinson, Columbus Blue Jackets, David Bell, Cincinnati Reds manager, JT Barrett, Cardell Jones, Anthony and Chris Grant, and by the way, of course, he's the University of Dayton Coach of the Year. Congratulations, Coach, for a great season. And Graham Rahal, IndyCar driver. Take a look.
Hi, Jim Tressel here from Youngstown State University.
Hey, this is JT Barrett here.
Gene Smith, your athletic director at The Ohio State University.
Matt Brown here, professional UFC fighter.
Cam Atkinson here from the Columbus Blue Jackets.
What's up, Team Ohio? How are you? This is Chris Spielman.
This is Anthony Grant, head basketball coach at the University of Dayton, and my wife, Chris.
Hey, everyone. I'm Jenny Brittenbauer, the founder of Jenny's Splendid Ice Creams, and I'm here on official business.
Just a few tips and reminders to help avoid the spread of COVID-19.
We want to be staying at home as much as we possibly can, keeping that social distance.
My family's been tucked away at home since the NHL announced the suspension of our season. We're trying to do what our public officials have asked of us to keep not only ourselves, but our fellow Ohioans safe.
We're in a fight, and one thing I know about Buckeye State, when we get in a fight, we fight back, and we win.
When you cough, cover your cough. Make sure you don't cough on others. Make sure you wash your hands for a minimum of 20 seconds. A new practice that I think will be with us as we move forward past this issue. Make sure that you do everything that you can to protect the vulnerable.
We encourage you to engage in physical and mental activities like exercising, going for walks in your neighborhood, reading, or simply engaging in fun family activities within the confines of your home.
It's critical that we all understand the importance of flattening the infection rate curve of this virus to prevent overwhelming our healthcare system and save lives. It's going to take all of us.
Because together you stand, divided you will fall, but in unity there is great strength. And in this country and in this state, we have unity and great strength. God bless.
Well, thank all of our participants today and all the people who are out there creating their own videos. I've seen some, and they're just great. Thank you, everybody, for getting in the spirit and for conveying that message every single day. I received an email from a friend of mine yesterday, and maybe I can clarify something. He said, he says, Mike, I go to the cemetery and visit my wife's grave almost every day. He says, I'm concerned that people think that they can't go to the cemetery. So certainly people can do that. We can do that. Usually hardly anybody there. You can certainly keep the social distancing. You can do things like that. Those things that you're doing every day, you don't have to stop doing that. So I just thought I would mention that. My friend contacted me and basically said, hey, tell everybody that it's okay. As we have watched what's happened in other places, We've watched what's happened in other countries in Europe. We've watched Italy. We've watched them at different stages. Now we certainly are looking at New York and other states. We're seeing how they deal with it. We're seeing how they've prepared for this. And I think it's important for us to, again, recall what our goal is and how we achieve the goal. And one of the very specific goals, as we talk about flattening that curve, what we really mean is to do the things that we have to do so that our healthcare system is not overwhelmed and that our healthcare system can take care of people who come down with this virus, who need to be hospitalized. Again, as Dr. Acton has said, most people will not need to be hospitalized, but some will. We know that. Being able to take care of them, being able to take care of people who have a heart attack, a stroke, any other medical emergency. And so that's very, very important. And we're doing this really in two ways. We talked about a moment ago in the videos, the social distancing. That's things that each and every one of us can do every single day. And we keep talking about that because we know it is so very, very important. And what we do today is going to impact where we are in the next few weeks as we go forward. The other thing that we have to do, and we're doing these simultaneously. These are not exclusive. We got to do both of them. But the other thing that we're doing is really working on capacity. And this is something that Dr. Acton, that Lieutenant Governor Houston, myself, and all our team and all the team across this state are working on every single day. And so I thought I'd just share with you all a little bit of what we are doing and how we are approaching that. And it is certainly a work in progress, but it's important for us to get the capacity up. We're talking about capacity with beds, capacity to make sure that everyone, the doctors and other first responders, have the personal protection equipment that they need. Maybe talk about beds. We're working each day with the hospitals throughout the state of Ohio and analyzing what those needs are, getting ready, trying to see what we need where. And again, this is something that has been worked on for a number of days, but I just wanted to mention it today to tell you we're working on this. What we have done, and Dr. Acton indicated this a few days ago, we've taken a lot of her health team and we merged them into what's called the EOC. The EOC is the Emergency Operations Center. It exists. It's existed for a number of years. And has some great people who are out there doing great work. It exists in case of any kind of emergency. It might be a flood along the Ohio River, might be tornado, might be any kind of emergency that we have. So what's happened is Dr. Acton's medical team, health team is kind of merged in there. So some of our team is merged in there. And each day I'm able, as I did this morning, to talk directly to them and get an update as far as how things are going. So they work with Ohio hospitals and medical experts every single day. They work on logistics. They work on moving stuff. And that's a work in progress. Part of this is what's called modeling. You've heard Dr. Acton talk about modeling. We are in the process of modeling. The Ohio Health Department, the Ohio State University, the Ohio Hospital Association have all gone together. As we say, we are in this all together. They've gone together to form this modeling team, and they're working hard on that every day. Cleveland Clinic also has a separate modeling team. They're comparing notes, working together. It was my pleasure this morning to be on the phone with the Cleveland Clinic CEO for probably 45 minutes just to see how everything is going and things are being pushed together. Innovate Ohio, that's headed up by John Houston, where we're bringing people in from the private sector to come in and help us with this modeling, help us with all the logistics, help us with the planning as we get ready for what we know is coming. And again, we know what's coming because we've tracked what's happened in other states, we've tracked what's happened in other countries, and our goal every single day is to prepare for that. And we do it, as I said, in two ways. Number one, we do it by the social distancing, and second, parallel track, we're also doing it by getting ready, physically getting ready for this. Let me talk for a moment about the personal protective equipment, PPE. This is a term that you've heard a lot in the last few weeks. Dr. Acton will talk a little bit more about it. But this is one of the things that we're focused on, our team is focused on every single day. Personal protective equipment. What is that? Well, it's gloves. It might be masks, gowns, face shields, goggles. And they're needed by our first responders. They're needed by our medical personnel. And I know in talking to first responders around the state, they fully understand that, and our commitment is to do everything we can to get them the gear that they need in a timely manner. Just to give you some perspective, over a 24-hour period, on average, 36 pairs of gloves are used to care for one patient who's in intensive care. This is why we have ordered non-essential or elective surgeries. We've ordered elective surgeries to be postponed, and we're seeing that happen across the state. We've asked dentists, we've asked veterinarians to conserve their supplies, and again, not do the surgeries unless those are absolutely necessary. This is why we're asking private business to help us in regard to this, and we're asking them in a number of different ways. We're asking them, some of them, to give us some of that equipment that they have, conserve it. We're also asking a number of these companies to be involved in either procuring it or actually making some of this equipment. And again, all this is a work in progress, and I just want to thank everyone out there. There's so many of you who are working on this, and this is something, again, that is certainly very, very important for all of us. Let me talk for a moment about our economy and where we're going, because that certainly is on everyone's mind. And let me just say that every single day I think about those of you who are unemployed. I think about the small businesses. I know from a family background and being in small businesses, I know that each day that goes by that you don't have income, each day that goes by that you can't move forward is just very, very, very tough. And I fully understand that. What we've done, we have done, as we've said, to protect lives. But I want to talk a little bit about how we come back. I want to talk a little bit about our economy. I've been asked, I was asked this morning, as well as last night, if I had any reaction to some of the president's statements yesterday. Let me just say, I think that the president and I are aligned. We want to get this over with as fast as we can. We want to get people back to work. The frustration that he has, I share that frustration. And each day that we can't move forward in that regard is a very, very frustrating thing. So I think we're all in this together, and I think we all have really the same feelings about this. The truth is that protecting people and protecting the economy are not mutually exclusive. In fact, one depends upon the other. The fact is that we save our economy by first saving lives. And we have to do it, and we have to do it in that order. If our hospitals are overwhelmed, if thousands of our fellow Ohioans do not get the care that they need, if many of our nurses and doctors get sick and don't get the care that they need, if they die because we do not have the facilities to protect them, that's a personal tragedy for them. It's a tragedy for all of us. And it's also not helpful at all as we look to how we rebuild this economy as we move forward. That would be truly, truly destructive of our economy. So these two things are tied together. And we've got to get them right, and we've got to do it, and we've got to do it in the right order. Let me also say that when people are dying, when people don't feel safe, this economy is not going to come back. So we have to flatten that curve. We have to do everything we can to separate ourselves from others. We have to do everything we can so that when this wave comes, and we know it's coming, it's not as big as it would have been, and that we're prepared for it. And so those are the things that we really must do. So if we're going to get our economy back, and I see it, I drive around, I see what's going on or what's not going on, but we've got to do this, and we've got to get through this. And we've got to get through it. We've got to protect as many lives as we can, and then we got to get ready to move forward. So I'm anxious for that day. That day is not yet here. Let me now turn to Dr. Acton for a few comments, and then to John Houston, and we'll be ready for questions.
Hi, everyone. Good afternoon. I just want to take a moment to say a special thanks out to our entire team, my team at the Ohio Department of Health. They've been working tirelessly since probably early in January on this response, and I couldn't be more proud of them. A special shout out to my communications team out at the Emergency Operating Center. I appreciate all that you're doing. What I just saw and the governor's team put together out in this amazing commercial that's going out, it just really warms my heart, and I know it does yours. So you're just doing an outstanding job. And, you know, the governor has really created an incredible team of people to help us through this response. So it's, of course, an honor to work for him and our lieutenant governor. And I just want to share with you, I feel like my role combing through this is keeping you understanding the science behind this and sharing the numbers as we have them. So let me share that we do have 564 confirmed cases. Again, my caveat, this is the tip of the iceberg. This is still behind, a little bit lagging in time from getting test results, as well as our still ramping up testing capability. But we do know for certain that we have at least 564 cases in Ohio, and now those are in 49 counties. We have age range of less than 1 year of age to 95 years of age. And I'm very sad to say that we now have 8 deaths in Ohio. We have some new statistics I'll share. 145 hospitalizations of those cases, 62 in the ICU, 25 of which are from long-term care facilities. As we've seen in other states, nursing homes, long-term care, particularly hard hit. And again, I just think we have an amazing team supporting those out on the front lines, but it really is those folks helping the people we love that are doing just such an amazing, amazing job right now. I do believe we have some data to share with you. This is the beginning. Those of you who ever had me as a professor of global public health will know that I'm a big fan of Hans Rosling. great TED Talk, one of the greatest statisticians. And we have teams of experts, of scientists from multiple universities, and we're working around the world with other folks doing modeling, some really great tech people, Innovate Ohio, as was mentioned, folks from universities all over this country. But we're learning some basic things, so I'm going to start with basics today, and we'll fill this out in the days to come. But some of our graphs will be on our website, coronavirus.ohio.gov. But what you can see is sort of a cases by county representation. Obviously, this is very, I want everyone to understand that cases are impacted by, if we could go back on that slide for a second. This is still by where we had testing the most quickly. So we really, it doesn't give maybe the fairest representation what's happening, for instance, in Southeast Ohio. Some of that's lagging. But you can see that also our daily increase in cases that has been going on. Next slide. We're going to start following for you a little bit. You know, we are seeing some trends here. And first of all, confirmed cases in healthcare workers. Of course, everything we're all doing is to protect those on the front line. We do know of our cases, 16% have come from the healthcare sector. Our hospitalizations of our cases right now is about 25.7%. I've said all along that about 80% of us will be able to ride this out as an outpatient, but we're seeing a little bit higher number of hospitalizations of our cases. And I think we're going to see that trend around the country. And then, of course, 11% of our cases have needed the ICU. And the ICU, folks, is our focus through this. It's all about the capacity of our hospitals to treat the sickest. So those numbers we will follow in days to come. Next slide, please. This is since the day back in March 8th, I believe, when we recorded our very first case in Ohio. We've been watching our trending lines, and what this graph is saying is, you know, what we've been saying all along, you know, it's expected in countries around the world that we will be following more of what we've seen in Italy. That is certainly the case in Ohio, as in every other state. And we're also following, you can't see very well on this, I think, but New York. I mean, the latest science, Dr. Ezekiel Emanuel from the University of Pennsylvania did a great op-ed in the New York Times. But what we can really expect is that we're on a 7 to 14-day lag behind New York City. So the rest of us in the country can sort of see what's happening in the places where they had their peaks and their testing a little sooner. Again, we know we're very close by, but we're lagging in that testing ability due to supplies. Next slide. Again, guys, it's all about the curve. And so we're doing our very best to keep everything we're doing with our measures and our policy is helping minimize the impact on our hospital system. And we are definitely up the steep slope. But what's most important is to start talking, next slide, about our hospital capability. Next, please. Ohio's response is really around two major areas. One is decreasing the spread, and two, as the governor just said, much better than I can, the increasing our capacity through our emergency operations. So the stay at home is still everything that you can do at home. It makes a tremendous difference, and I promise you, Ohio, when we look back at what you have done, you as citizens have done, it is going to have made all the difference for us. We're doing policies to relieve the healthcare system burdens, and that was our trying to get rid of elective surgeries, getting our equipment from out in the field in. We're doing amazing things, converting anesthesia machines to ventilators. We're doing all sorts of things to increase that system, but you should know we will be having to build additional beds, just like you're seeing in places like New York. And then finally, this conserving PPE. Next slide. Bed availability in Ohio hospitals. I have a lot more on this days to come, but a couple numbers that I want us to start out with. We are at about 60% capacity in our hospitals. After our elective surgery stopping, we're about 60%. Our ICU beds in total in Ohio are around, I believe that says 3,600. the bottom line that we're learning now is it's all about ICU bed capacity. What you're going to see, and we're doing a lot of what we are seeing being done in Maryland, we're trying to keep people that can be routinely cared for, even that needed hospitalized in lesser care settings, and turning our hospitals into basically expanded ICU capability. On average, we're needing our hospitals to increase that capacity by 50%, and our hospitals are hard at work doing that. And we will be looking at things, you'll hear more in the news in the days to come, about hotels, and even dorm rooms being turned into hospital units. So that is something we're having to do in Ohio, much like you're seeing happening in New York right now. Fortunately, we have a few more days to get that up and running, and we're learning from what's being done around the world and in New York. And then finally, last slide. We did distribute almost all of the PPE we have received has been put out in the field. Remember, PPE is personal protective equipment. That's what the governor talked so eloquently about, the gloves, the shields. There is a limited supply, that is the truth, and we have deployed that based in the need around counties, and you can see that by this graph. If you go to the next slide, please. Is that the last slide? We also have on our website what that entailed, what actual amounts of PPE. I think we have to realize that when we deploy PPE, we're doing it in boxes and cases, not truckloads. But the good news is that we have some really amazing researchers working on ways to reuse PPE. Both here at Battelle in Ohio and also at the University of Nebraska. They're looking at UV light. So there are new guidelines coming out every day, every hour of how we can extend the use of that PPE. But I want to say to you again at home, what you're doing by stopping the spread is absolutely taking the pressure off our healthcare system, saving it for those of us who need it, you know, the unexpected emergencies that we routinely have, and most importantly, for the cases that we know to come. We know that at some point soon, in a worst case scenario, had we done nothing in Ohio, and we're doing everything the science has said to do in Ohio, but they're anticipating that there could be up to 6,000 new cases a day if we aren't all abiding by these things we're doing. And if you had 6,000 new cases a day, clearly that would quickly outpace our hospital capability. And that's why every move you're doing is making all the difference. So thank you. Thank you for following the governor's sage guidance. Honestly, I couldn't explain our situation better than he is explaining it today. So please continue to follow his guidance and his lead. Thank you.
John?
Well, thank you, Governor and Dr. Acton. I was thinking as we were getting ready to start today, talking with the governor, what we do is that every day we tell you what we know, and then we finish up and we leave here and we collect a whole new set of information, the latest information that we can get from our experts and really from people across Ohio. And we use this as an opportunity to try to address the issues that people bring us. And one of the issues that certainly has arisen over the last couple days after the stay-at-home order was issued is the definition of an essential business. And we spoke with mayors and business owners and business associations over the course of the last 24 hours. And so I want to put a little more guidance for you, and really definitive guidance that we hope you will follow as we all in Ohio, I know, are trying to comply with the stay-at-home order and the essential business list, and we want to give you the best possible guidance we can to help you come to the conclusions that you need to come to. First of all, at coronavirus.ohio.gov, that's where the director's stay-at-home order is located. So you can go there and look at it. That site has already had 1.3 million hits today. At the moment that we announced this on Sunday, in 1 minute it had over 1 million hits. And so we're glad that you're using it. And we know at times it gets overwhelmed, but our systems have been working very well today at that website. So read the order, and then the attached Homeland Security directives or guidance that's in
I want to run through the number of cases here in the state of Ohio. A jump of about 27% in confirmed cases in the past 24 hours. We now have 564 confirmed cases in 49 counties. 145 people have been hospitalized. That's an increase of about 39% in the past day. We now have 8 deaths here in the state. The ages range from a baby less than 1 year old to a 95-year-old person. The director of the health department here in Ohio, Dr. Amy Acton, said that initially she was saying that about 80% of people who become infected with COVID-19 will not need to be hospitalized. Based on the numbers we have so far, she's now reduced that. She says it appears that about 75% of the people who become infected will not need to be hospitalized because about 25% so far have to be taken to the hospital. The beds here at Ohio hospitals are currently at 60% capacity.